Right.
And we have an animation, Drew, and Lisa, to show everyone what happens during a C-section and why there's this weakness in the uterus.
Basically, there's usually, if it's not an emergency, there's usually a cross incision in the skin, and then a lateral, or we call a transverse incision at the lower base of the uterus. And then we reach in, and this is actually a breech delivery, which is what she's talking about that she had, and we reach in and we grab the baby's feet, and then we do a twisting maneuver, the arms, and then the head, and the baby's delivered during this incision in the uterus. But that incision is, again, like Drew said, it's a weakened area. So with the contractions of the next labor, it can rupture, and what happens is the mother hemorrhages and the baby dies because it loses blood. But again, that's a 1% chance, and there's 75% success rate with VBACs, but the risk is a huge risk. So that's why some hospitals are, not willing to take that risk.
Because if you fail, if it doesn't work, you're talking emergency C-section, which is a lot worse than a planned C-section.
And what we as OBs have to tell the patients, we can never necessarily, guarantee that we can get into the baby.